Dear colleagues, there's often confusion about the differences between the CGFNS certification exam, the NCLEX RN exam, and the Credential Evaluation Services, CES. It's important to clarify these distinctions, especially for international nurses aiming to practice in the United States. Both the CGFNS certification exam and the NCLEX RN exam typically require a CES report. However, not all state boards of nursing mandate the CGFNS certification exam. While passing the CGFNS certification exam can be a good indicator of potential success on the NCLEX, it's crucial to understand that passing the NCLEX RN is the ultimate requirement for obtaining U.S. RN licensure. Some states may even issue a temporary permit to work as an RN for 6 months, contingent on passing the NCLEX during that period. The key question is, why spend additional time and money on the CGFNS certification exam when you still need to pass the NCLEX RN, and both exams require the rigorous CES process? Even after passing the CGFNS certification exam, you must still pass the NCLEX RN to be licensed as a U.S. RN. Let's explore the key differences between the CGFNS certification exam and the NCLEX RN. Purpose: CGFNS exam. This is a credentialing exam designed to assess whether foreign-educated nurses possess the necessary knowledge and skills to practice nursing in the U.S. It is often a prerequisite for the NCLEX RN in some states and is part of the CGFNS certification program. NCLEX RN exam. This is the licensing exam for becoming a registered nurse in the U.S., focusing on the application and analysis of knowledge to ensure safe and effective nursing practice. Exam content. CGFNS exam focuses on basic nursing knowledge, including medical, surgical, maternal, child, and psychiatric nursing, with an emphasis on theoretical aspects. It also assesses English language proficiency and general healthcare knowledge. NCLEX RN exam concentrates on practical, clinical decision-making skills, such as client care, safety, infection control, pharmacology, and patient management. It uses computer adaptive testing to evaluate the ability to apply knowledge in real-world scenarios. Eligibility. CGFNS exam. International nurses must meet specific educational and licensure requirements from their home countries. It is often a prerequisite for nurses from countries where the nursing education system is not equivalent to that of the U.S. NCLEX RN exam requires completion of an accredited nursing program, either internationally or in the U.S. Some foreign nurses may need to complete the CGFNS process before taking the NCLEX RN, depending on state requirements. Requirement: CGFNS exam required by certain states for foreign nurses before they can take the NCLEX RN. It is also necessary for visa applications for nurses coming to the U.S. NCLEX RN exam mandatory in all U.S. states for licensure as a registered nurse. Cost: a CGFNS exam generally more expensive due to the inclusion of credential verification and additional services like transcript evaluations. NCLEX RN exam usually less expensive, though costs vary by location. Time to complete. CGFNS exam, the process can take longer due to the documentation, verification, and evaluation involved in assessing international education and credentials. NCLEX RN exam can be taken after completing the CGFNS process or directly if CGFNS is not required by the state. Test structure. CGFNS exam, paper-based with multiple choice questions, focusing on foundational nursing knowledge and theory. NCLEX RN exam, computer adaptive testing that adjusts question difficulty based on the test taker's performance, with a greater emphasis on clinical applications.